Good afternoon, Dr. Dalalia and my fellow classmates. I'm John Jarrett, and unfortunately I cannot be there to provide my presentation on ethics in academic medicine. However, I have uploaded a PowerPoint for you to follow, and we shall begin. I am an employee at the University of Arizona in the College of Medicine, and our mission is to promote health and well-being not only locally but globally. And we also want to improve upon diagnostics, therapeutic modalities, and preventative medicine for the students and providers of healthcare that utilize this lab. And this is where my job comes to play. I am the instructional specialist coordinator and clinical educator for the Arizona Simulation, Technology, and Education Center, otherwise known as ASTEC. We use these lifelike mannequins that generate their own vital signs and behave like real patients to train these students and providers. And our goal is to provide a non-punitive format where we actually challenge these students and providers to make mistakes so that they make them here and not on actual patients. We do this by promoting the elements of team dynamics, which was proposed by the Interprofessional Education Collaborative of 2011. This new format in training healthcare providers involves knowing one's strengths and limitations, learning to communicate and communicate effectively, and demonstrate mutual respect and constructive criticism while resuscitating a patient that is critical and non-critical, so to speak. But the question I have for myself and my peers in healthcare and healthcare education is, are we making the grade? Because a 1999 report by the Institutes of Medicine brings up an alarming fact. Annually, healthcare mistakes are a leading cause of preventative death. And I want to emphasize that. Healthcare mistakes are a leading cause, not the leading cause, even though some would argue that, of preventable death annually. And if you look at one slide that I provided, it's pretty phenomenal how it demonstrates how it falls in the top 10 leading causes of death as reported by the Centers for Disease Control, with heart disease still maintaining number one. So how do we approach this? How do we, in a time of limited resources, limited finances, train students and providers following every possible aspect of medical asepsis or sterile fields, using technology that is hundreds of thousands of dollars to obtain, let alone operate and implement? The challenges are very, very extreme and dynamic. We are battling with tradition. Some curricula is heavy in lecture and very limited in actual clinical hands-on training. And people get into their silos, so to speak, and feel that their profession or their discipline is more important than others. And so globally, we have a lot of challenges in front of us in order to address this heavy concern about medical death annually in our society. But I always remind my participants that the main goal is, number one, it's okay to make mistakes. Number two, it's okay to forgive yourself for making those mistakes. But to always strive to do the right thing all the time and every time. And learn to be supportive of one another, because this is a very challenging field. These are very challenging times, and unfortunately, we are not evolving quick enough and smart enough to really start socially discussing this concerning concept of medical errors and preventable death. It's quite alarming to know that most hospitals are not mandated to volunteer this data, and this data remains protected by continuous process improvement programs, policies that protect not only patients' right, but also inhibit the ability to knowledge share amongst students and providers in our community. So I hope you get a lot from this presentation. I'm not certain where I am in time, but I'm hoping I've met my time limits. I thank you very much. Have a great session today. Bye.